No summer plans for anybody? Spring? Nothing? I know it's been a rough winter, especially with all the dreary days we've had without sunshine. I think we had 2 days of sun in 3 months. It was pretty awful. Camping? Yep, that's what I'm hoping to do too. A bit of a road trip up northern Ontario for myself to explore that. OSCE exams, always a fun one. Eating for insulin resistance, hopefully, after you'll be going through this information today. I'm hoping people will get outside and enjoy nature a little bit as well. It's always good for the mind and body. So I think we will start at 7. We'll give some people some more time to kind of pop in. And just for the sake of time, I think we'll get started right away at 7. We have lots to cover, and I want to make sure that I can get through everything this evening. And feel free to drop something in the chat about what you're hoping to learn tonight. I'm most likely going to cover it, but if I don't, I'm happy to make sure I touch on it tonight. Are a lot of you people local, or where are you signing in from? I think this went out to pretty much anyone in Ontario. Norfolk, nice. Always like going to that area. Beautiful area to camp in. A lot of really fun gems in that area to visit. Guelph, yep, close by in Waterloo. All right, so it is 7, so I'm not going to delay getting started. Hopefully people are able to hop on soon. So like I said, tonight we're going to talk about insulin resistance and how it can be the root cause of many health concerns. I am a naturopathic doctor at the Natural Choice Medical Clinic here in Guelph, and I am very passionate about this topic, and I'm really excited to share this information with you tonight. Okay, so a little bit about me. I'm a naturopathic doctor. I've been practicing for about 8 years now. I do have a general practice with a focus in weight management, hormonal health, digestive concerns, fatigue, and mental health concerns. Definitely not everything I see, but a good portion of people who are coming to me have a lot of these concerns. I studied at the Canadian College of Naturopathic Medicine in Toronto, and I regularly attend continuing education courses, particularly about this. I'm passionate about helping my patients find the answers and achieve their health goals. And I do try to strive to make treatment plans manageable, which is some feedback I've received from other patients who've seen other providers, that they just want to make sure it's doable so they can stay on track and hit their goals. And as much as possible, when evidence is available, I do try to use that to guide my recommendations for my patients. Okay, so what are we going to cover today? We're going to talk about who insulin resistance impacts. What is it to begin with? What factors contribute to it developing? How to test and screen for it, and ways that you can improve your insulin sensitivity, and how to book an appointment at the clinic if things sound like it would be a good fit for you. These are concerns that you're experiencing and you need a little bit of support. We'll be chatting about that as we go along as well. Okay, so when you hear insulin resistance, most people are thinking diabetes or polycystic ovarian syndrome or PCOS. However, there are a lot of things and symptoms that we will often not associate with insulin resistance, like this whole list. This is not comprehensive, but this covers a majority of what can be an issue when it comes to developing it or contribute to insulin resistance. The biggest one there would be the weight loss resistance, which is the most obvious one. When we're having blood sugar rise, we tend to carry more weight or have more of that adipose or fatty tissue gain. Fatigue and or brain fog is another really common one when we're struggling with blood sugar regulation issues, especially after eating, and particularly after eating higher carbohydrate meals. So blood sugar regulation, if you're getting hypoglycemic, especially soon after eating, that's not normal, and it's likely related to insulin resistance or the things that you're eating. Cravings are really common with people who are having insulin resistance because essentially they're not getting the sugar into their cells and they're feeling like they're starving, or their body feels like it's starving, so it constantly is putting more food into the system. Mood concerns, especially anxiety, can be related to insulin resistance. So if any of my patients are coming in with this mood concern, I am screening for blood sugar regulation issues. When our blood sugar drops, our stress hormone cortisol will spike and it will cause us to feel more anxious and stressed out. So it's really important to make sure we're keeping our blood sugar stable throughout the day, especially if you're experiencing these mood concerns. Fatty liver disease, it's now called metabolic fatty liver disease instead of non-alcoholic fatty liver disease. It's one of the primary causes of insulin resistance, and insulin resistance contributes to it. So it becomes a vicious cycle. So this is something that I'm often looking for in my patients, or people are coming in with it. I'm looking for the insulin resistance piece to make sure that their treatment plan is addressing it. High insulin contributes to miscarriage risk when it negatively impacts the embryo's development and impacts the blood flow to the uterus, increasing the risk of miscarriages. So if people are having issues with fertility, especially if they have PCOS, or they're having miscarriages even just one, this is something that I'm looking for in my patients. Hair loss or acne. So insulin is very inflammatory, so it can cause hair loss at the follicle level or contribute to acne. It also alters some of the androgen or testosterone type hormones, so it can contribute to that from that perspective as well. Heavy periods can be an issue for insulin resistance. It alters the production of estrogen and how we break it down, so that's how it links into this. Insulin resistance also increases in menopause due to the decrease in the appetite suppression effect that we have when our estrogen starts to drop. So this is something that I see a lot in any of my patients who are 40 and above. All of a sudden, their weight management just gets out of control. They don't understand what's happening with their body anymore. So it's something that I am screening a lot of my perimenopausal and menopausal patients for. Insulin is pro-inflammatory, so if I'm seeing a lot of pain or swelling issues, I am looking for this in my patients as well. And I've seen some of these recommendations that we'll talk about today really improve some of those symptoms. Sleep issues, one can contribute to insulin resistance, and melatonin will decrease insulin resistance. So if you're having a lot of poor sleep or bad scheduling with your sleep, especially if you're a shift worker, you'll naturally have more insulin resistance because of that. Thyroid dysfunction, so insulin signaling, it feeds back to suppress the thyroid production, and it will also impact our conversion from the free T4, which is what our thyroid produces as a hormone, to the active free T3 form. So we obviously want more of the good active form, and if we have a lot of insulin resistance or a lot of insulin floating around in our system, we won't have that conversion happen at the same degree. There is a causative connection between the gut microbiome, so essentially the bugs in our gut, and insulin resistance. The GI mucosal membrane that lines our gut is damaged by higher levels of insulin and glucose. And this is a really important layer that feeds the bacteria that are growing in our gut, and they create certain compounds in our body that are really protective and helpful for us. Okay, so how prevalent is it? So these are stats from the States. However, a lot of the same societal problems and dietary issues that we have are very similar in Canada. So they're estimating up to 75% of the population in the US is insulin resistant or having insulin dysregulation issues, and 52% of adolescents, which is a really shocking number to see this because usually it was something that was coming up in their age for people, but we're seeing kids who are under 10 even having issues with this. So, in terms of our approach, we really need to change our healthcare approach. A lot of the times we are focusing on reactive medicine instead of kind of getting ahead of things and teaching people how to be more preventative with their health. So, we want to look at the whole body and how we can help the body heal through diet and lifestyle and natural sources instead of chasing symptoms and suppressing symptoms. It's better to catch something 5 years in advance than catching it as soon as you're being diagnosed as pre diabetic. So making sure that we're looking at the whole body instead of the individual systems. So this is where unfortunately things seem to fall apart conventionally is you'll have different specialists for different body systems and they don't talk to each other. So we really want to look at everything as a whole. And luckily as a naturopathic doctor, we have that time to really try to play a health detective to look into this for you. So prevention, like I said, is really key. I'm usually looking at different lab values for patients. So not waiting until things tip over the edge on their lab testing. Oh, all of a sudden you're diabetic, but we've seen this coming for 5 years. So I'm usually looking at blood work really thoroughly for my patients and making sure that we're getting ahead of it and we're doing something about it while we can. So it's a little bit less difficult and less strict later on. Making sure that lifestyle and diet are considered the foundations of health. These aren't really discussed with most people with their doctors. There's a lack of time and unfortunately some lack of education on that side of it. Making sure that we do look and ask what people are eating, how they're sleeping, what is their stress management like, because these all impact pretty much all chronic diseases, and making sure that these are addressed on a regular basis is really important. So as an ND, I do focus on health optimization. So I want to make you feel as well as you can. I don't want you just feeling okay. Everything's normal on your blood work. You're good. Don't worry about it. I want to make sure that you're at an 8 out of 10 with your energy. You're sleeping great. Your digestion is good. You're at a comfortable weight for yourself. You're feeling strong. So I want you to feel your best. I don't want you to just feel this is as good as I'm going to get. I work at removing the barriers to the body's innate healing ability. So our bodies are really fantastic at knowing what to do. We just have to give them the right situation. So we need to give them enough sleep, enough water, proper food and nutrition. So finding where those barriers are and removing them as much as possible is going to be really important. So I do run comprehensive blood work for my patients. Some of them will get some of it done with their other providers, whether it's their GP or nurse practitioner, and I can fill in any gaps. Or some of them are really open to running a lot of the testing that I recommend, which is great. And making sure we have some of this data so I have the information so I can adjust the treatment plan so it's more specific for my patients and provide them with detailed treatment plans so they know exactly what they need to be doing. Okay, so I did want to pop on for a quick second about the discovery call offer in case people can't make it all the way through the talk tonight. So this is something that you can book anytime. There is a booking link in the chat. You'll see a big book now button. So these are 15-minute quick calls with me just to find out a little bit more information if you have more personal questions, not too sure if it's going to be a good fit for you. You can book one of these and I'll give you a call. There's a few times available on there that you can select and I will call you at your scheduled time and we can chat and just make sure it's going to be a good fit if you're not too sure about booking an appointment. Okay. All right. So what is insulin resistance? So the normal way that our body functions is that when we eat, our blood sugar or blood glucose goes up. And then we pump out insulin from our pancreas to allow the glucose to move into the cells. and out of the blood sugar. So there are receptors on the surface of the cells that allow this to happen. In cases of insulin resistance, that receptor isn't functioning the way that it should. So instead of the glucose going into the cells, it gets stuck on the outside. And then our body in response keeps putting out more and more insulin because it's not getting the message. So this is kind of the later part of insulin dysregulation. When we get to this stage, there are earlier signs that we'll see with the symptoms that we had talked about and with some of the testing that I'll talk about as well that we can screen for this. Eventually, if the whole system starts to fail, this is when our blood sugar keeps rising and then we're diagnosed with diabetes. I'm just going to take a look at the questions and make sure I can hit on this. Okay, so I'll talk about the keto diet. More about the testosterone. Okay, so we'll talk a little bit about fasting as well. I can't give any specific medical advice in this, obviously, as a webinar, but if you have really specific questions and you do want to book one of the discovery calls, please let me know. Okay, so like I said, the insulin resistance is the end of the cascade, whereas the insulin dysregulation is more of the issue. So with the resistance, it's that sensing issue where the receptors aren't picking up the sense that there's enough insulin there, and it leaves a lot of the glucose on the outside. So the insulin resistance is actually a protective mechanism for the body. So I mean, it's a sign, and obviously we want to correct that, but it is the body's ability to try to fix the situation before it gets tipped over into the diabetes realm. Okay. Okay, so what is insulin involved in? Well, it's involved in weight regulation. It controls our appetite and our cravings. It controls triglyceride synthesis. So these are the little lipid particles that develop if we have too much carbohydrate and we can't bring it into our cells. We store them as triglycerides. These typically are what are stored in the liver and contribute to fatty liver disease. Insulin is really important and involved in cholesterol management, the androgens, like I mentioned before. So this is a really complex kind of hormone cascade that we can kind of talk about if this is something that you feel like is a part of your puzzle. But there is a big connection in PCOS, for example, with insulin resistance as well as androgens. So you can test for these in blood work, which is usually what I recommend if people are suffering with these particular concerns, just to see if it is fitting your case. The estrogen production, like we talked about, the liver and thyroid dysfunction, and then the gut issues that we talked about. Okay, so what affects insulin release? So obviously what you eat will affect this. So glucose, protein, and fat, and they all impact it on a different level, which we'll talk about in a little bit more detail. Sleep is really important for insulin sensitivity. With the lack of sleep, you can get stuck in a fat storing mode and develop elevated blood sugar and insulin levels. There were studies that were done that even a few nights of sleep deprivation, we're talking like 6 hours of sleep, essentially aged our metabolism and increased insulin resistance really significantly. The good thing is our bodies get up bouncing back in these short periods of time, but if you're chronically doing this with your sleep, it's not going to be able to bounce back as easily, and you will start seeing symptoms and more of that insulin dysregulation turn into the resistance, potentially into the prediabetes and diabetes. So making sure that you're getting enough sleep will help control appetite. If you're not, you will find that you're hungry more often. Obviously, it will impact our mood and our anxiety and our stress hormones. And if our stress is going up, it tends to kick up our blood sugar, which just releases more insulin, which is making the problem worse. And we're essentially slowing our metabolism down if you're not getting enough quality sleep. Okay, so one of the recommendations for this is keep a consistent bedtime routine as much as possible, making sure that you're getting enough sleep. If you need 8 hours of sleep to feel good the next day, get all the activities that you need done and not feel tired, then that's what you should be aiming for. So finding that sweet spot for yourself is really important. Ideally, avoiding blue light devices, especially phones before bed. People just tend to scroll forever on those and not get to bed at an appropriate time. And they just keep the mind really active so that you're not in that sleepy state when you're supposed to be. So when it comes to sleep, we don't want our nervous system in this fight or flight mode all the time. Essentially, we still have a very primitive nervous system. So when we're stressed out, our nervous system is essentially thinking we're running away from a bear. So we don't want to feel this way all day because it does affect our blood sugar regulation. It shuts down our digestion and other healing parts of our body when we're thinking we're in that acute stressor. So chronic stress will impact the way that we're storing fat and where, and it will impact inflammation throughout the body. It will impact our appetite, our ability to heal, our immune system, our thyroid function. And remember that stress isn't just the mental and emotional, it can be physical stressors as well. So a gut microbiome problem, if you don't have a good balance of the good bacteria or overgrowth of the bad bacteria, or you have a food sensitivity and you're constantly getting this inflammation in your gut as a result, or you're not dealing with nutrient deficiencies, and you're not dealing with your blood sugar swings appropriately, or if you do have a lot of inflammation in your system that we're not addressing, this is considered a stressor for the body too. So it's not just about feeling stressed mentally. Okay, and then we did cover inflammation a little bit. So having that kind of vicious loop, if you have inflammation, it will cause blood sugar issues will cause more inflammation. So making sure that we're addressing any sources of inflammation from the body or from external things like certain medications might be driving this a little bit. Are you on antibiotics all the time, affecting your gut microbiome? We want to make sure that we're addressing that. Okay, so the pulsatile secretion of insulin is really critical for health. So what this means is essentially when we eat, our glucose goes up, and then our insulin goes up in a response to bring the glucose into our cells. This should be happening in a pulsatile way throughout the day as we're eating. So essentially, if you're having 3 square meals a day, it should be going up and then falling. You should have a nice low period between your meals, and then it's going to go up again with your next meal. Overnight, what we want to see is a nice low period for your insulin output. You shouldn't be eating, ideally, for at least 12 hours overnight between your dinner and your next meal in the morning. And this is really important for how our insulin will function in our body. It should account for 75% of our insulin release in this pulsatile secretion method. And this is a reason that I don't recommend snacking to my patients. So we've become a culture of snacking. People are eating every 2 hours, they're constantly having food and grazing all day. And this is essentially affecting your pulsatile secretion. And if you lose that pulsatile secretion of insulin, it is a direct line to diabetes development. So, as much as you can, making sure you're having good, nutrient dense meals that holds you over between your meals 4 hours or so. You should be able to do that with what you're eating, and making sure you can at least fast the 12 hours overnight. In terms of extended fasting, it really depends on the person. I'm not recommending it to people across the board. 12 hours should be a safe number for most people. And based on testing and based on the case information that I get in my initial appointments or subsequent appointments, I will tweak the fasting windows depending on the person. You really have to be careful with extended fasting, especially as women, because our hormones are very sensitive to this. So if you are a cycling female, you do not want to do really extended fasting because you can throw off your menstrual cycle as well. A lot of the research that was done and a lot of the longer fasts or a lot of the intermittent fasting was all done in men. Okay, I'm just going to check some questions. Okay, so water fast of days, I do not recommend doing really extended fasting without talking to a medical professional. So I can't comment on that because I don't know your health history. A1C testing, we'll talk about that. Okay. So make sure I'm keeping up on the questions here. Okay. Okay. So another factor that's really important. So obviously we want to be able to control the amount of insulin that's being put out. Certain foods will stimulate this more than others, which we'll talk about. But the other side of it is making sure that we're getting rid of the insulin. So insulin is made and then it goes through the portal circulation, which is part of like the liver system. Anywhere between 20 to 80% of the insulin is cleared by the liver. So different things will impact this: age, genetics, dietary macronutrient intake, the nervous system, and the presence of fatty liver. So making sure that we're looking at all of these systems, because in some cases, people are not putting out a lot of insulin, but they're also not getting the results that we're expecting. So you can actually test to see how well they're clearing insulin from their system. Okay, so as you can see, there are a lot of multiple factors going on when it comes to insulin dysregulation and resistance. So, really taking that whole body, whole person approach is going to be really critical for this. So, do you need digestive support? Do you need sleep support? What's your nervous system response like? Are you feeling anxious and on edge all day? What are you eating? Are you moving your body? So, making sure that we're addressing any of these things that are potentially coming up, and then individualizing that treatment plan. So there are several patterns of insulin resistance or dysregulation. This is something that I test my patients for. We can actually test for insulin and glucose over periods of time in response to a certain amount of sugar, for example. So this test, we can see if you're having high insulin on fasting, or is it just in response to a certain amount of sugar? How high is your insulin going during that test? Is it even coming back down to baseline at the end of that time test or not? And from there, we can really get an idea of what recommendations are going to be the best for you, given your severity of insulin resistance. Okay, so testing. So again, this is general. Obviously, I'm coming up with very individualized test lists for my patients, but these are some of the key ones. Certain nutrients are really important, vitamin D being one of the big ones. Unfortunately, they delisted this off of the OHIP coverage about 13 years ago now. So only certain people are able to get this covered, but I think it is definitely worth the $35, $40 to get this tested to make sure that you're getting enough. The other thing is vitamin D, you do store it. You do not want to take high doses of it without proper testing because it can be toxic. Thyroid testing. So this is something a lot of people will get done. They're told their thyroid looks normal, nothing wrong with it. The problem is there's usually just one screening test that's being tested. I'm usually running 3 to 5 tests for the thyroid to look into it a little bit further. Liver function test. This is really important, especially if I'm looking for any fatty liver disease. Lipid testing. This would be your cholesterol, triglyceride test, insulin and glucose testing, like I mentioned, and those inflammatory markers just to make sure that inflammation is not part of the issue. If they're coming up high, we can help figure out where the inflammation might be stemming from. Is it coming from the gut? Is it just the glucose regulation problem that's driving that up? A thing I like to mention about the testing is that as a naturopathic doctor, I can order all of these. They're not covered by OHIP, unfortunately, but some people are able to get some of the testing done through their other providers, and I can fill in gaps or I can run it for you, and sometimes insurance does cover them. Okay. So, in terms of this, I kind of want to check in on people. This is something I hear a lot in my practice. You've had testing done, you don't feel well, you're convinced something's going on with your thyroid, or there has to be a reason for it, and you're just told everything looks normal, there's nothing that can be done. So, I want to kind of get an idea where people are at. Is this something that you've experienced in the past? You can put it in the chat if you guys are willing to share. I do see a question here from Olivia about the A1C test. So it is a 3-month average of your glucose control. I run it regularly for my patients. It gives us a general idea of blood sugar control. It does not necessarily screen for insulin resistance. However, the ranges, if you've ever seen them on a lab report, are pretty wide. So usually I'm recommending an A1C of 5.3 or lower is optimal, ideally keeping it under 5.5. Life Labs has ranges 5.5 to 5.9 is considered at risk. 6 to 6.4 is pre-diabetic, and 6.5 and higher is considered diabetic. So I use it, and I will often use that as a bit of a marker moving forward to see that things are moving in the right direction. Obviously, we want to see it come down and away from the diabetes level. Right. Okay. Yeah. Medicating. Yeah. Tells you to lose weight, doesn't tell you how. Don't give you any guidance in managing anxiety. And a lot of them, unfortunately, some of those medications do come with weight gain and other issues. Of course, I'm not anti-medication. I think they're really important when used properly, but there are some other options. So 5.5, I would say 5.3 and under is optimal for an A1C. And fine, not to eat carbs, given no other information. Yeah, I see this a lot. I've had people with fatty liver being told not to eat any fat. It's definitely more of the carbohydrate issue. Um, but looking at some of this insulin information, just of how it ties together, making sure there's other liver supports in place, digestion is supported, I think that would be really important. Everything's fine, everything's in normal range. Yep. So when I go through blood work with my patients, I'm going line by line and we're spending a lot of time so they fully understand their blood work, where the ranges optimally should be, because the ranges on the testing, they're just population numbers. So they're trying to give us the best idea of where a normal would be, but they're not necessarily testing this on healthy people. For example, the thyroid test values, I think originally were like medical students, which are not a great source of healthy or not stressed out people. Okay, how insulin resistance work during pregnancy? Okay, so for gestational diabetes, like that is something obviously that's screened for in pregnancy. I would say if you are getting anything flagged during that window of time, there's a much higher likelihood of you developing insulin resistance when you're not pregnant. So that's something I actually ask my patients about regularly. Have you ever been diagnosed with GDM? How was your pregnancy? Making sure that we're addressing that if it's coming up, because it just shows that there's a bit of a weakness there that we can deal with, even if their blood sugars come back normal since they were pregnant. Okay. Okay, so like I said, taking that comprehensive health history, so spending the time looking at all of those body systems, finding out past medical history, like, do you have a gallbladder? Was it removed? All of a sudden, was your weight gain since then? That is a huge question that I ask my patients if I'm seeing that on their medical history form. One, it will affect our digestion. The bile acids are incredibly important for regulating the gut microbiome, as well as having a big role to play in insulin resistance. And getting the data, like if possible, to get the testing, I always recommend it.
Hi, everyone. So we're just having a little bit of a technical issue. Tiffany, I'm not sure if you can hear me, but I can't see you in the room anymore or the slides at all. Um, so are you able to just log out and then log back in using that same link? I also can't hear you, so hopefully you can hear me.
Okay, can everyone hear me now? So sorry for the technical glitch. I just want to make sure we're back on here. Okay, perfect. So I was just talking to no one there for a little bit. Okay, so everyone, we left off on this about getting data. So I'll move on to the next slide for the sake of time here. Okay, so what can you do about it? This is obviously why a lot of you are here today. And I just wanted to kind of ask, many of you are feeling completely overwhelmed and confused by the dietary recommendations and lifestyle recommendations available online and on social media. Because this is what I see a lot in my office. People come in with a bag full of supplements. They're like, I don't know what I should be taking. Person at the health food store told me to take this for what I'm dealing with. My family and friends told me to take this. What do I do? And what is working? What dosing am I using? And essentially, I'm just trying to save money and hassle for them because I'm usually going through all of their supplements. We're doing a full supplement review and saying this is worth keeping, this is not a right dose, this is the wrong part of the plant, and just making sure they have a really clear understanding of where everything is at with their supplements. And unfortunately, a lot of the information online is not great. It's a lot of gimmicky things, fad diets that may or may not work, might work for one person and not for another. It could actually do more damage to that person. So having somebody like myself on your team to make sure that we're making sure the recommendations are good for you is really, really important. Okay, so lifestyle reset is one of the really important parts. So looking at time restricted eating, somebody mentioned a bit about intermittent fasting. So this is something that I do talk to my patients about regularly. Again, tailoring it depending on their test results or health goals, and what their symptoms are to make sure that this is appropriate. So again, not going crazy with this, but a 12-hour fast overnight is definitely a good starting point and should be really what everybody should be doing. You don't need to be fed all the time. And making sure that we're not in a fed state or growth state all day long. It does not have any benefit for anybody. No one needs to do it unless you're pregnant or you're a young child. So stop with the snacking and make sure that you're fueling yourself properly throughout the day and that you're not all of a sudden just picking up all the food intake at the end of the day because you've been starving all day or grazing on snacks. So again, the testing can be really helpful to figure out the ideal fasting windows for yourself, and making sure that you are having good combinations of foods so that you're not just eating carbohydrates and then starving in 2 hours. And then, of course, you're going to want to have a snack again. Looking at combining foods in a really good way. So there's smart food combining. Do not combine high fats, high sugar foods. These would be like fried foods, baked foods. These have a high amount of sugar, have a high amount of free fatty acids. So what happens is it actually decreases your insulin clearance rate and you have a higher insulin release. So it's a double whammy for that. So really try to steer clear of some of these foods. Watching saturated fats and sugar, especially fructose. So looking at the coconut oil fad that we had about 10 years ago, where everyone was slathering coconut oil on everything, drinking it. It is a saturated fat. When used appropriately and in moderation, it can be a good part of the diet, but people were going crazy on it. It was actually having detrimental effects to their gut health and their insulin sensitivity. Making sure that we have the polyphenols in the diet. So think of anything that's colorful, that's a fruit or vegetable, spices, herbs, nuts and seeds. We want lots of these in our diet. There's a lot of research around these being protective for our system. They can positively shift the gut microbiome, decrease inflammation, minimize the sugar effects of carbohydrates from a meal. So making sure you are getting a wide variety of these in your diet every single day. The typical minimum recommendation is 2,000 milligrams or 2 grams of these a day. Okay, and looking at changing the macronutrients in your diet versus focusing on calories. I do not recommend calorie counting for really any of my patients. I just want to make sure that they're getting enough fuel, that they're feeling full and satiated, they're not feeling restricted throughout the day, and we can really make sure the macronutrients like the fats, the proteins, the carbohydrates that they're getting are working for their body. Making sure you're getting enough sleep, and really hit that home earlier. So making sure that you're getting the 8 hours if you feel like you need it, you're getting to sleep easily, you're staying asleep throughout the night, and making sure that you wake up feeling rested. Like you should not be dragging your butt out of bed, and you should not be hitting snooze 5 times for an hour in the morning. Okay, so what should you eat? Protein is really, really important. We want to make sure every single meal has a good amount of protein. So this will anchor our meals. And then we want to make sure that we load our plate with these non-starchy vegetables. So essentially anything that's not a potato or a squash is considered non-starchy. And you can eat unlimited amounts of these. They're very low insulin stimulation for our system. Fats, especially the healthy fats, so olive oil, nuts and seeds, avocado, these have less of an impact on the release of our insulin as well. And they're also very satiating. Most people like fats, they're very filling, they're very satisfying. They'll help you feel full so that you're not crashing in a couple hours. Choosing high fiber carbohydrates and more complex carbohydrates when possible, um, and making sure that we're just getting enough fiber in general. Most people don't consume enough. For women, it's at least 25 grams of fiber per day. Men, it's closer to 40 grams a day. So these are really important because they act as fuel for our bacteria. They keep us feeling full. They help regulate blood sugar and cholesterol. And of course, they keep us regular in terms of bowel movements. It's just really important for our body functioning. Avoiding packaged and processed foods as much as possible. We can't control the ingredients. They tend to have a lot of chemicals in there that are detrimental for our gut and our health. So sticking with the periphery of the grocery store as much as possible. Fresh, frozen fruits and vegetables are ideal. And if you do need to buy any canned items, you can just make sure that they're a little bit cleaner, ideally, and then making sure you're getting your protein, whether it's from animal sources or plant-based sources. You can eat for your insulin following either of those types of diets. Okay, so I like showing a little bit of information around foods and insulin stimulation. So somebody kind of mentioned about the keto diet. It's obviously still very popular, and I've seen many people come in and out of that diet in my practice over the years. I have a few issues with the keto diet. One is a lot of people aren't doing it properly. They're having a lot of dairy-rich products, a lot of bacon, a lot of saturated fats, and I'm seeing their cholesterol go through the roof, and their doctors are telling them you have to stop doing this. So there is a better way of doing it where it is very plant forward. You're getting those healthy fats that we talked about. So a lot of the insulin stimulation related diets are like keto in that sense of what they're trying to accomplish, but they're less restrictive because I haven't found many people who can stick with keto for more than 3 or 6 months, and they just find it too difficult, too restrictive. So eating more for your insulin where things are not necessarily restricted. We're just trying to make sure that what you're putting on your plate makes sense for your blood sugar goals and your symptoms. So looking at this chart, for example, you see 1 cup of berries being 2 insulin stimulating points versus a medium banana at 25. That's a huge difference. So if you're going to be choosing one, the berries would definitely be the better choice. Plus you get all those great polyphenols and fibers with the berries. Not to say you couldn't have banana, but it would just be something you would factor in when you're building your meals. Non-starchy veg, like I said, pretty much free. A cup of cooked rice, quite high in comparison. The legumes are a good option because they have those complex carbohydrates, the fiber and the protein to help offset the carbohydrate nature of them. Potatoes, again, if you're having things that are fried like fries, this is going to go up even more significantly than what's listed on here. Avocado is mostly fat, so again, that's why it comes in more neutral. And a cup of wheat-based pasta, whether it's white or whole wheat, is around this amount. So a lot smaller serving sizes than what people would typically be eating, but it's something that I review a whole list of these foods with my patients, especially if they're doing some of the insulin testing, so that we can figure out what they're currently eating, what we can kind of tweak and make sure that they're not feeling overly restricted and they feel empowered of what they're putting on their plates. Okay, so like I said, food restriction is not the goal. We have a huge problem right now where people are obsessed with their diets, and I want to make sure that people are not restricting their diet unnecessarily, but we want to change the way that you portion your plate and emphasize the lower insulin stimulating foods. We want to make sure that we're fueling our bodies properly and that you're feeling satisfied through the day. Okay, so everyone was always going to ask about supplements. Was there anything I can take to help? The answer is yes, potentially. So some of the herbs and nutrients or nutraceuticals can be helpful. There's some research around them, but they're typically not helpful in isolation. You have to consider these other factors to help tailor the treatment. And they're typically used temporarily to shift physiology and make things move. So I'm constantly reevaluating these recommendations with my patients so they're not just taking something for the rest of their life if they don't need it. Okay, so I did want to kind of go through a really quick case example. I know we're kind of near the end of our time here, but we had that technical difficulty. So I just wanted to kind of give you an example of someone I had seen, started seeing them about a year ago, and they were having chronic fatigue and pain, joint pain, chronic headaches, difficulty managing their weight. They were really having a poorly managed thyroid condition. They had hair loss and thinning. They were having a lot of anxiety and low mood concerns, low motivation. They constantly felt swollen and puffy. You could see it in their face. They were having a lot of poor sleep, very high stress, very busy schedule. So we went through this case. We did some of the blood work. We optimized their thyroid medication, and we actually uncovered that they have an autoimmune thyroid disease that was driving that. They lost 25 pounds. They've been able to drop 2 sizes. They have more energy, ranking at 7 to 8 out of 10 consistently. They've even added another program into their schedule, like an additional education program on top of their jobs. Their hair is growing again. Joint pain and swelling and headaches have greatly reduced or resolved altogether. Sleep's improved, and they're able to actually relax and enjoy their downtime. And then we repeated those labs a year later, and things that actually started shifting. So it's always really helpful when we see those numbers change when you're putting in those efforts. So a note here about wanting to take the next step. So again, I know this is more of like an introductory because I can't give a lot of specific medical information. If you do have any questions and you're not sure if I'm somebody who can help you, feel free to book one of these discovery calls. You can see the book now button in the chat. So this is for the webinar attendees. I'm going to be doing them tomorrow and as well as next Monday. If you can't find the time, reach out to the clinic. I'm not too sure how many people are going to want to sign up for these. So if you can't find a spot, just contact one of our patient care coordinators and be happy to set up a time for you. So a little bit of information of what these look like. So these are up to 15 minutes. They give you an opportunity to ask some questions, briefly discuss any concerns that you have. Just again, making sure it's a good fit before you dive in and book an initial appointment. If you don't have any questions, you just want to book anyways, you can feel free to reach out to the clinic and they can set up a time for you as soon as possible. So what you'll see is when you book it, you'll see some time options you can choose from, and I'll give you a call at that time. I will be calling from a block number most likely. So in case you screen those, just make sure you pick up. I will try you 2 times if I don't reach you on the first go. Alternatively, you can call the clinic and speak with one of our patient care coordinators if you have any other general questions for us. If you decide to book an initial appointment, I can do these either virtually or in office. So I can see anybody who resides in Ontario virtually, which is really great. So you have access to that care, and you will receive an intake form to complete before we connect or meet. We do direct bill many insurance providers here at the clinic. So a lot of the time the appointment fees are covered. And in some cases, the testing fees are as well. So if you are looking to book virtually, but you want to do testing, don't worry. We typically just do those and send you the requisitions. So you don't actually need to come into the clinic to do any of the blood work. So if that's something that you're interested in, you could do it either way. Okay, so here's the clinic's contact information if you need to reach out, and we look forward to hearing from you. I think I covered pretty much all the questions. If I didn't, please reach out and book one of the discovery calls, and I'd be happy to chat with you. And thank you again for all your patience and for coming this evening. I hope you found it informative, and I look forward to hearing from some of you. Have a good night. Bye-bye.